Now we'll study the elbow joints. It also belong to the most important joints. First tab is compound joints. The compound joint means there are not only one joint. There are at least two joints in one joint. If one joint has at least two or more joints, it's a compound joint. And in elbow joint, there are three joints in it. Then is composition of it. There are three bones in this joint. First one, this one is humerus, yes. Here is the right humerus and the lower portion of the humerus. And this one is on the right side, the middle one bone is ulnar, yes, the top of the ulnar. And the lateral side is readers, right of the readers. And now you know here is our right upper limb. Okay, this one is ulnar, this one is readers, this one is humerus. Okay, let's continue. And the three bones that connect each other will form three joints. Between the humerus and ulnar will form joints. This joint is humeral ulnar joint, humeral ulnar joint. And between the humerus and the readers is humeral reader joints. Okay. The third one, between ulnar and the readers, because here is proximal end, and another side is the distal end. So here is proximal radial ulnar joints. Radial ulnar joints. Okay, add three joints. 1, 2, 3 joints in the elbow joints. So it's one joint has three joints, so it's compound joint. It's the meaning. Okay, it's first the composition. In your final examination, we often test this question. Please describe the composition of the elbow joints. To here, it's not the end. Why it's not the end? Because they are also joints. So then you to describe these three joints composition. Yes, the composition. Okay, so it's not the end of the description of the composition. Now let's continue to describe the composition of these three joints. First, humeral ulnar joint. Here, between the humerus and ulnar. The first, the lower portion and on the medial side, on the humerus, there is trochlear. This one is trochlear. If you forget what's the trochlear of humerus, please go back to the bone to study the humerus, the structure of the humerus again. It's on the lower portion and the medial side. There is the structure is trochlear. And another structure is trochlear notch on the ulnar. You see here is the ulnar. Okay, should be here. And here you can't see the back of the ulnar. Here is the head of the ulnar, from the anterior to posterior and upwards. And this one is trochlear notch. Trochlear notch and trochlear, they are face to face. And trochlear is the head. Trochlear notch is a curved surface. They are face to face, will form humeral ulnar joint. The second joint, humeral reader joint, is between humerus and readers. On the lower portion and the lateral side of the humerus, there is capitulum. This one, capitulum. It's like a small head. And on the superior portion of the readers, there is articular fovea. on the head of the readers. And these two surfaces, they are face to face, will form humeral reader joints. And the third joint is between ulnar and the readers, is proximal radio-ulnar joints. Now let's see the composition of these joints. First one, on the reader, on the top of the readers, there is a articular circumference of readers. It means around the head of the readers, there is a circumference surface around, or circular surface around it. Okay, and the medial side of this surface, of the circumference, connect with the ulnar. And here is the lateral side of the ulnar, will form a reader notch. Because connect with the head of the readers. So the name is reader notch. And this is the surface, this is the notch. The two surfaces face to face will form these joints. Okay, understand? Okay, it's the composition of third one. Now you have described all the composition of the three joints. Okay, humeral ulnar joints, humeral reader joints, and proximal ulnar reader joints or reader ulnar joints. Here is the end of the description of the composition of elbow joints. So the elbow joints is very complicated of the composition. Okay. Let's continue to study about the second part, about the characteristics of the elbow joints. The characteristics of the elbow joint is very easy. It's not very complicated like the composition of it. Now let's see. The first one. The three joints are enclosed by a single capsule. You see, the three bone or the three joints, they are enclosed by a very thin, only one capsule, the first one. And the capsule is very thin and loose, not very, very strong. And you can touch your elbow. The anterior surface or the posterior surface is very thin, especially the posterior part. You can touch the bone, ulnar, oligrenin on the back of the ulnar. You can touch all the surface of the bone. And the skin and capsule is very, very thin. It's like a paper, very thin and loose. Because it's thin and loose, so your elbow can flexion and extension easily and freely because the thin capsule. But on the lateral side, it's also the right elbow joints. Here is the lateral side, here is the medial side. The medial side we name another name is ulnar side. The lateral side another name is the reader side because of the ulnar and the readers. Okay, now you see the two sides. There are two ligaments to strengthen it. On the medial side, this one is ulnar collateral ligament, and on the reader or lateral side is reader collateral ligament. Okay, reader collateral ligament and ulnar collateral ligament. Okay, on the two sides to strengthen it, prevent these elbow joints move medially or move laterally. This location medial or laterally. Prevent. Okay, and there is another one, annular ligament. Annular ligament is around the head of the readers. Okay, go to the back. There is the round one. It's like a circle. This one is annular. Annular is like a ring. It's a ring ligament around the neck of the readers. Okay, it's the three ligaments to strengthen your elbow joints. Okay. Now let's see them one by one. First is the reader collateral ligament. Reader on the lateral side is also the right. It's a right elbow, and it is the lateral view You can see the lateral ligament from the lateral side of the humerus. Here is the lateral epicondyle of the humerus. Then go downwards to the radius. Okay. And the next one is also the right elbow, but this one is medial view from C8 on the medial side. From the medial epicondyle, go downwards to the ulnar. Okay, and this one is ulnar collateral ligament, prevent the elbow move medially. Okay. Now let's see the third one, annular ligament. Here, it's like a ring around the neck of the radius, okay, and from the ulnar, here is a notch, radial notch, from the anterior margin of it, then go laterally around the neck of the radius, then go backwards, then move medially again, go back to the posterior surface margin of the radial notch. Okay, this one is annular ligament. What's the function of this ligament? You see this ligament is around the neck of the radius and prevent the head go downwards. It's function of it. In adults, this ligament is very strong. Your head of the radius can't go downwards. But in some child, they are very, very gentle. It's not very, very hard, not very dense, not very strong. And you know, the child is very naughty. When the parents go outside with their kid, the parents very loud the kid, the child, one person reads one arm of the child, and it often happened dislocation. You see, because this annular ligament is not very strong, so this action often make the head of the radius go downwards. It's one kind of dislocation. But this dislocation is not very serious. Only perhaps the head will block in here, not totally go downwards. We name this dislocation is subluxate. Okay, it means the radial height partially dislocated, not totally, through its ligament. Okay, this often happened the child under 4 years old. Subluxate. Okay. And now let's see about the movement of the elbow. The movement of the elbow is easy. Only one pair, flexion and extension. You know, forearm and arm, they are closer, is flexion. If they depart, is extension. Okay? Okay, they are more closely flexion. More far away is extension. Okay, it's about elbow.